is Tiana. I'm one of the nurse practitioner students here. We're doing a head-to-toe assessment on you today. What's your name?
My name is Julie.
Hi, Julie. Nice to meet you. Can you tell me your last name and date of birth?
Smith, birthday 11/20/95.
All right. And can you tell me where we are today?
Student health.
Okay. Thank you. So I'm going to be talking during this exam. I'm going to be working from head to toe. If I say any words that are confusing or anything, let me know and I'll clarify with you. Okay. So I washed my hands before I came in, so I'm nice and clean. I'm going to start with your head, and your head appears to be atraumatic, but I'm going to look for any lumps or bumps or deformities. Pretty symmetrical skull here. Also going to look at your hair. Have you noticed any thinning of your hair recently?
No.
Okay. Any itchiness, lesions, spots, anything like that? All right. Looks like you have a nice healthy head of hair on you there. So now I'm moving down towards your face and looking at symmetry, and I'm going to assess some of your cranial nerves. So if you could smile for me, good. Squeeze your eyes shut. Can you raise your eyebrows? All right. Can you puff out your cheeks? Perfect. I'm going to get something here. I'll have you close your eyes, and you tell me if you feel a soft or sharp object.
Soft. Sharp. Soft. Sharp. Soft. 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 Sharp. Sharp.
All right, great. I'll have you clench your jaw real tight. Any pain there? All right, I'm going to feel for your pulse. All right. And have you had any trouble chewing? All right,
No.
You open and close your jaw. All right, can you shift your jaw forward for me? And can you pull it back? All right, thank you. All right, so your TMJ appears normal, no clicking. I don't feel anything shifting in there. I don't see any redness or anything along your skin there. So moving down to your neck, looking at your trachea, it appears to be midline. Can you swallow for me? While I'm here, I'm going to palpate your carotid pulse on both sides. All right, it's equal on both sides. I'm going to go ahead and palpate these anterior lymph nodes. Have you been sick recently? Any swelling or anything?
No.
This size, shape, and mobility of your lymph nodes is normal. I'm going to go from behind here. Still looking at those lymph nodes, pre-auricular and post-auricular. I'm going to go down under your jaw here, feel any swelling there. Any pain? Okay. Any pain there?
No.
All right. I'm going to continue with the thyroid assessment here. Have you swallow? No. All right. And if your thyroid is normal in size, if it was enlarged, I would listen with my stethoscope for a bruit. I'm going to assess your trapezius muscles here. Any pain?
No.
And then can you push up against my hands? Good. All right. So let's see here. The next thing that I'm going to be doing is looking at your ears, your eyes. I'm sorry. I'm just going to keep going. All right. So moving on, to the eye assessment. We'll do a visual acuity first.
Okay.
So with both eyes, what's the furthest line down you can see?
The bottom one.
Alright, can you read that for me?
L T F P H.
Alright, can you cover your left eye? What line can you read there?
The same one.
Okay.
L T F P H.
Alright, and cover your other eye.
L T F P H.
Alright, looks like your visual acuity is 20/20. Gonna check those visual fields now.
Okay.
So, you just look straight into my eyes here. I'm gonna be wiggling my fingers, and you tell me when they come into vision for
Okay.
you. So you can just say now.
Okay.
Okay.
Now. 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 Now.
Alright, good. Now can you cover your right eye? Yeah, same thing here. Tell me whenever these fingers come into your
Now.
visual field.
Now. Now.
Good. And we're gonna do the same thing on this side.
Okay. Now. Now. Now.
Alright, great. Alright. Now we're gonna take a look at the outside of your eyes, looking at your eyelid here. If you could just close your eyes. Gonna palpate the lacrimal apparatus. I don't feel any swelling. I don't notice any excessive tearing or dryness. Normal hair distribution of your eyebrows and your eyelashes. I'll take a look at your iris now and your pupils. So I'm gonna have you just look over my left shoulder as I do this. Alright, so your pupils are equal, round, and reactive to light. They're about 4 millimeters in diameter, and they accommodate. I'll just have you follow my pen light here. Alright, thank you. Next part of this exam, I'm going to use the other ophthalmoscope here. Alright, so I have my ophthalmoscope here. I'm just going to maybe get it turned on here.
Push it in and over.
Okay, it's different than mine at home. Thanks for letting me borrow yours. Alright. Alright, see that red light reflex? I'm getting closer here, and I'm going to adjust my ophthalmoscope here to find your optic disc, and it is sharp. And can you just look right into my ophthalmoscope? Great, I don't. Alright. Same thing on the other side. Take this back down to 0. And I see that red light reflex. Let me get a little closer here. And then again, I'm going to adjust the ophthalmoscope to focus on that optic disc, and it appears to be sharp. No, can you go ahead and look right at me this time? Right, great. No signs of papilledema. So your eyes appear in normal health. We'll move on to your ears. Alright, so just looking at your ears here, they are symmetrical and even on your skull. I'm going to look at the outside of your ears. Is anything bothering you on the outside?
No, I don't think so.
Okay, no lumps, bumps, or lesions. I'm going to palpate your tragus here on both sides. Is there any pain there?
Mm-mm.
Any pain, and I palpate on your mastoid.
No.
Alright. Now, I'm going to do a whisper test to check your hearing.
Okay.
So if you could just close that ear with a finger.
Okay.
I'm going to whisper a number, and you tell me what you hear.
Okay. 75.
Alright, and can you do the same thing on this side?
29.
Alright, good. And you passed that whisper test. I'm going to take a look with my otoscope here. So I'm just gonna brace my hand on the side of your head
Okay.
here to keep me from poking you here. And looking at your auditory canal, it is clear. No lesions or cerumen. I see your tympanic membrane, it's pearly gray and intact with a cone of light. I'm gonna switch over to the other side here. Again, I'm gonna brace your head and pull up on your auricle here. The ear canal is clear. No foreign bodies, lesions. I see your tympanic membrane is intact. Sorry, am I hurting you?
Oh, no, sorry. That's
Okay.
fine.
All right. The inside of your ear appears healthy. All right, now I'm gonna take a look at your nose. Yes, I'm gonna look at your nose. Inspecting from the outside here, the bridge of your nose looks normal. I don't see any lesions, a small nevi. I'm gonna press here. Tell me if there's any pain in your sinuses.
No.
Any pain there? Okay. Let me just, before I look, I'm just gonna assess down here. Any pain there?
No.
Okay. Can you close one side of your nose and kind of take a breath in? Okay, and the other side? Okay. And is there any difference in either side?
No, I don't think so.
Okay. I'll have you just tilt your head back. I don't see any septal deviation. I'm gonna take a look with my otoscope here. Nasal mucosa is pink. A little red there. All right. Nose appears healthy. Now I'm going to assess your chest. No, I'm not. I'm going to assess your mouth. Sorry about that.
That's all right.
I'm going to get my gloves on for this part of the exam.
Okay.
Has your mouth been bothering you? Do you have any loose teeth or sore at all?
No, not that I can tell.
Okay. Alright, so just going to inspect your lips here, and they appear moist, no lesions or sore. So I'll have you open up and looking, all of your teeth are intact. All right. Just gonna look at the side of your cheeks here. Your buccal mucosa is pink. Can I see under your tongue? All right, I'm gonna just shift it to the side. Okay, and can you shift your tongue to the side this way? Good. And then I'll have you open up all the way and say ah.
Ah.
Sorry, I'm gonna gag you here a little bit. All right. Open up one more time and say ah.
Ah.
Use my pen light and look at the back of your throat here.
Ah.
And you still have your tonsils. Okay, you like +1.
Okay.
All right. I'll have you just stick your tongue out at me. It's the last part of this exam, nice and straight there. All right, thank you. That was just an assessment of a cranial nerve. So now we're moving on to the chest. So looking at your chest here for symmetry, your respirations are non-labored. The depth and rate appears to be normal. I'm visualizing where the point of maximum impulse would be down here, but we'll look at it later as we go on to the cardiac exam. I'm going to go ahead and take a listen. Before I do that though, I'm looking at the diameter of your thorax, and I don't notice any barrel chesting. Your width is longer than the depth, which is normal, which is what we're looking for. You can just breathe normal here. Move to your back. Again, just breathe normal. And as I'm listening here, I'm looking and inspecting for symmetry, lumps, bumps, or lesions on your back. You take a nice deep breath. And again, normal breath sounds, no crackles, wheezes, or wails. Just going to check the expansion of your thorax here. If you could just take a nice deep breath for me and let it out. Good, and that appears to be even. Now I just want you to say 99 as you feel my palms on your back, okay?
99, 99, 99. 99, 99.
And again.
99, 99.
All right. Tell me if you feel any pain here.
No pain there. No pain there either.
Okay. All right, moving on to your upper extremities here. I'm just gonna take a look at your shoulders, then your elbows, then your wrists and
Okay.
hands. Okay. So first here with your shoulder, palpate across the scapula here and your clavicle till I come to the acromion process. Any pain as I'm palpating?
No, no pain there.
You just lift your
Oh,
elbow
sorry.
back like that. Yep. And we're just going to palpate again. You tell me if there's any pain.
No pain.
Okay, I'm going to do the same thing on the other
Okay.
side. Again, to the acromion process. Any pain as I'm palpating there?
No, no,
Any pain here?
no,
Pain here?
no.
Any pain there?
No.
Again, I'll have you just hold back this way. Any pain there?
Mm-mm.
Alright, now we'll just go through some range of motion with your shoulders
Okay.
here. So can you just stretch your arms out to the front and down to your side? Can you take them back down to your side? Flap them up. Can you bring your hands together up top? Alright, back down. And then can you bring the back sides of your palms, or your hands together at the top? Okay, back down. Can you lift your arm up like this? And then down to the ground? Okay, and then up to the ceiling? Alright, now take your hands and put them behind your back like this. Any pain there?
Mm-mm.
Okay, you can bring them back out. And then I'm just gonna have you reach across your body with one hand. So stretch all the way out that way. And you can straighten your arm.
Okay,
Yep.
sorry.
Oh no, you're fine. And then again with this one. Any pain there?
Mm-mm.
Alright, so no signs of like a rotator cuff strain or anything like that, so that's good. We're done with your shoulders. I'm gonna move down to your elbows.
Okay.
And just palpating all the bones of your elbow here. Also gonna check that pulse. It appears to be normal. Any pain
No.
on any of these points?
No.
Okay. Alright. Alright, I'll just have you do some range of motion here with your elbow. Pull all the way up,
Okay.
all the way down, back up. I'm going to pull down and you try to stop me.
Okay.
Alright, and then I'm going to push and you push against me.
Okay.
Alright, good. Alright, moving down to your wrist. I'm going to feel these carpal bones here. Have you been having any pain whenever you're like typing or any tingling or numbness in your fingers?
No, I don't think so.
Okay. Have you rotate to the side here. I'm going to, they call this a snuff box. I'm going to palpate that, and there's no pain whenever I touch
No.
there, so there's no sign of a fracture there. I'm going to feel those pulses, and they are both equal. Look at each joint in your hands. Your capillary refills less than 3 seconds.
Okay.
I'm going to check the range of motion of your thumb. If you can just rotate that, good. And then I'm going to kind of push against it and you push back.
Okay.
Good. So your thumb strength is good. Same thing on this side. Good. Can you spread all of your fingers apart? And then, oh, sorry. Try not to let me close them.
Okay.
All right. Good. And can you go back and forth like this on your lap? Good. All right, so that is your upper extremities. We'll go ahead and lay you back for the lower.
Okay.
Okay, so looking at your legs for symmetry, your legs appear to be the same length. Temperature is warm. Any open ulcerations, sores, or healing wounds on your feet or
No.
legs? Okay. Going to palpate your hip bones here, and the iliac crest, and the greater trochanter. All right. I'm going to check your lumbar spine here. I'm going to slide my hand under you, and I'll have you bend this knee up to your belly and leave that one straight. Great. Okay. Back down. Same thing with this one. Good. And you have normal flattening of your spine there. Right, let's go ahead and do a range of motion with your hips. I'll have you bend your knee here. All right. And I'm going to push in. Good. Do the same thing on that side. Now can you take this leg and kind of drop it down to the side and back, all right, and back up? And can you cross it over your other leg? Any pain there?
No.
All right. I'll have you scoot over on the exam table and try the same thing on this side.
So down over?
Yeah.
Okay.
Okay, and back up and across your body that way. All right, good. All right, now I'll move down to your knees here.
Okay.
Just gonna feel for your pulse here. All right. Do you care if I lift up here?
Okay, all the way.
Sorry. Alright. Alright. Any pain as I touch behind your knee here?
No.
Have you had any pain whenever you're walking up and down stairs, popping, clicking, anything like that?
No.
I'm gonna have you bend at your knee,
Okay.
and I'm just gonna go through a range of motion here. And then I'll have you bend that way. Alright, no clicking there. Sorry. Any pain there? I know that
No.
feels weird. Okay, now then. No popping or catching there. Alright, moving down to your feet here. Actually, I'll have you take your shoes off for this work. Sorry.
That's all right.
Feeling for your pedal pulses. In here. Good. Can you put your toes down towards the ground? Bring them back up to you. Alright. Can you push against my hands? Good. And then push down on my hands. Good. And your strengths are good. +4. Let's just do a range of motion with your ankle here. I'll have you rotate around. Alright, any pain there?
No.
Okay. Alright, so done with lower extremities. We're gonna move up to the cardiac part of the
Okay.
exam. Well, just a couple points here.
Okay.
I'm gonna just raise the bed here to 30 degrees. And I'm right-handed, so I'm gonna stay on your right side.
Okay.
Alright. And it's gonna be palpating, so actually, so. You take a nice deep breath and hold it for me. Okay. And then I'll feel for the point of maximum impulse down here. I'm gonna go ahead and listen to your carotid pulse. For any bruits, using the bell of my stethoscope. Can you hold your breath for me? Okay, same thing on the other side. Alright, thank you. I'm gonna lower the head back down. Move on to the abdominal exam. Alright, can I lift your shirt up here a bit? Alright, so looking at your abdomen for symmetry, it looks very symmetrical. I don't see any bulging, no abnormal hair distribution. I don't see any signs of a hernia for your belly button. Before I start palpating, I'm going to go ahead and warm up the stethoscope here and take a listen to your bowel sounds. And I'm not noticing any aortic pulsations as I'm listening here either. Now I'm going to listen to your iliac and renal arteries for bruits with the bell of my stethoscope. Listen to your femoral arteries. Also listen over your spleen for any friction rubs. Listen over your liver for any friction rubs. to your aorta for any bruits. Good. Also going to feel your aorta, and it is less than 3 centimeters. All right, so I'm going to go ahead and do some percussion. Oh, actually, I need to check the reflex of your abdomen. I'm sorry, this is cold. Reflex is intact. All right. Going to assess your liver here. Okay, and there. All right. Can you take a deep breath for me? And I don't feel your spleen there, so no sign of splenomegaly. Now I'm going to palpate your stomach. So I'll have you raise your knees up. I'm going to start off with light palpation. Sorry, my hands are cold here. Deep palpation. Any pain?
No, not yet.
Not yet, huh? All right. I'm going to palpate the liver's edge here using the hook technique. Sorry, my fingernails are digging into you. Any pain whenever I let go here?
No.
Okay, so negative Murphy sign. And I'm going to palpate your spleen. Try to. And I can't, so that's a good sign. All right. Oh, last thing I need to do is your kidneys. I'm going to go around on this side. All right. All right. I don't feel your kidneys, so there's no kidney enlargement. I'll have you go ahead and sit up. You need help?
I think I can do it.
Okay. Sorry, let me lower the bed here for you. The last part of this exam, you can go ahead and put your shoes on for this. Alright, so I'm just going to have you walk over to the sink and back normally. It looks like your gait is normal. Can you do that again on your toes? Alright, and then come back on your heels.
That's harder.
Great, yeah. Alright, I'm going to have you just close your eyes and stand there. Do you feel dizzy or anything? And there's no swaying, so negative Romberg's test there. I'll have you just squat low with your knees, kind of like do a dip down, like a shallow, yep, okay, good. All right, now I'm gonna have you turn around here. I'm gonna assess your spine. So I'm just looking for a straight line down to the gluteal cleft here. I'm gonna take a look at your shoulder alignment with your iliac crest here, and it appears that your shoulders are in line. I'm gonna just palpate down along your spine here. You tell me if there's any tenderness. Anything?
No.
Alright, I'm gonna palpate each cervical faucet here. Any pain there?
No.
Alright, and your spine is aligned. I don't see any signs of scoliosis there. I am just going to have you bend at the hip toward your toes. Alright. Do that one more time. Alright, and back up. Alright, I'll have you just spin around towards me. And I'm going to do some range of motion here. Have you lean forward again. Alright, and back. And then, yeah, let me have you do that one more time. Alright, good. And I'll have you lean to the left, lean to the right. Alright, now have you spin around one more time here. And I'm just going to push you this way. Okay. And that way. Alright, I think we have covered everything head to toe. Thanks for being my patient
You're
today.
welcome.
And I'll see you next time when I'm a little bit better at this.